Oh, Vioxx. Remember Vioxx? It arrived on the scene like a superhero, a caped crusader for aching joints. This wasn't just another pill. No, sir. This was a revolution in pain relief. That's what they told us anyway. Merck, the pharmaceutical giant, beamed like a proud parent. They had a miracle on their hands, or so they claimed. It was marketed with all the subtlety of a monster truck rally. Bright, shiny advertisements promised a new dawn for arthritis sufferers. Freedom from pain, they chirped. And the best part, it was FDA approved. Yes, the Food and Drug Administration, the people whose job it is to make sure drugs are, gave it a big thumbs up. Safe, effective. What a combo. This drug wasn't just for any old ache, it was specifically for arthritis. Millions suffered, millions were desperate, and Merck knew it. They saw a market, a huge, aching market. Vioxx was presented as the answer to their prayers. Imagine the relief. Years of chronic pain, and suddenly here's this little pill, this marvel of modern science. It was supposed to change lives for the better. People trusted their doctors, doctors trusted the FDA, and everyone, it seemed, trusted Merck. The initial buzz was incredible. Hope, packaged in a prescription bottle. Little did they know what was lurking beneath the surface of this medical marvel. And then came the launch, 1999. The confetti flew, metaphorically of course, or maybe literally, in Merck's boardrooms. Vioxx hit the market, and it didn't just hit the market, it. This COX-2 inhibitor, rofecoxib if you want to get technical, but who does, was an instant blockbuster. It was designed for osteoarthritis, rheumatoid arthritis, and acute pain. Basically, if it hurt, Vioxx was there for you, or so the story went. The drug quickly became one of the most prescribed medications in history. Think about that. That's a lot of pills, that's a lot of trust. The financial success? Oh, it was staggering, astronomical even, we're talking billions, with a B. Annual sales for Vioxx soared past $2.5 billion. Yes, billion per year. It was a golden goose for Merck, a cash cow, a money-printing machine. Whatever financial metaphor you prefer, Vioxx was it. This wasn't just a successful drug, it was a cornerstone of Merck's entire financial empire. It fueled their profits. But here's the thing about monsters. They rarely stay hidden forever, even if you try really hard to keep them quiet. Whispers started, softly at first, then a little louder. Early studies, even before Vioxx was a multi-billion-dollar behemoth, began to raise eyebrows. Or they should have. One key study was called VIGOR. That stands for Vioxx GI Outcomes Research. Sounds reassuring, doesn't it? It was designed to show Vioxx was easier on the stomach than an older painkiller, naproxen, and it did show that. Hooray! But it also showed something else. Something far more disturbing. Something Merck seemed, shall we say, less enthusiastic about publicizing. The VIGOR study, completed in 2000, revealed a rather inconvenient truth. Patients taking Vioxx had a significantly higher risk of heart attacks and strokes compared to those taking naproxen. 5 times higher by some analyses of the data Merck initially submitted to the FDA. 5 times. That's not a rounding error, that's a giant flashing red warning light. But what did Merck do? Did they sound the alarm? Did they halt sales? Did they plaster warnings everywhere? Not exactly. Instead, the narrative became that naproxen was somehow of the heart, thus making Vioxx riskier. A clever bit of spin, that. Like saying your house isn't on fire, the fire next door is just really, really cold. Internal documents later unearthed suggested that some scientists within Merck were aware of the potential cardiovascular risks. They knew. Or at the very least, they had very strong, very worrying data. But Vioxx was making so much money. It was the jewel in Merck's crown. Admitting a problem, a potentially fatal problem, would have been catastrophic for profits. Section 4, the human cost. A trail of shattered lives. So, while the executives counted their money, what was happening out in the real world? People were taking Vioxx, millions of them. An estimated 20 million Americans alone. Globally, many millions more. They were taking it for their arthritis, for their back pain, for their post-surgery recovery. They were trusting that this FDA-approved, heavily marketed drug was safe. They were tragically, catastrophically wrong. The numbers are horrifying. Dr. David Graham, an FDA scientist who later blew the whistle, estimated that Vioxx may have caused between 88,000 and 140,000 excess cases of serious heart disease and strokes in the United States during the years it was on the market. Let that sink in. Up to 140,000 people. These aren't just statistics, these are lives. These are heart attacks during family dinners, strokes that rob people of their speech, their mobility, their independence. These are sudden deaths that leave families reeling, searching for answers. One of the most prominent stories is that of Robert Ernst. He was a 59-year-old marathon runner, healthy, fit, vibrant. He started taking Vioxx for hand pain. Less than a month later, he died suddenly from a cardiac arrhythmia. His wife, Carol, would later become a powerful voice for Vioxx victims, tirelessly seeking justice and accountability. Her husband wasn't a statistic, he was the love of her life, snatched away by a pill he thought would help him. Think of the scale of this tragedy. For every Robert Ernst whose story made the news, there were thousands more. Grandparents who never got to see their grandchildren grow up, spouses lost, futures erased. Section 5. The house of cards collapses, Vioxx pulled. But you can only keep a lid on something this big for so long. Eventually the truth has a nasty habit of elbowing its way out. For Vioxx, that moment came in 2004. The dam finally broke. And it broke because of another study, this one called Approved. That stands for Adenomatous Polyp Prevention on Vioxx. Cute name, deadly results. This study wasn't even primarily looking at heart risks. It was designed to see if Vioxx could prevent colon polyps. But, surprise, it found something else. Something Merck could no longer spin, explain away, or sweep under the corporate rug. It was the smoking gun. The Approved study showed, unequivocally, that taking Vioxx for longer than 18 months significantly increased the risk of heart attacks and strokes. Doubled it, in fact. This wasn't about naproxen being cardioprotective, this was Vioxx, on its own, being demonstrably dangerous over the long term. The data was so clear, so damning, that Merck had no choice. On September 30th, 2004, the company announced it was voluntarily pulling Vioxx from the market worldwide. Voluntarily. Yes, like you voluntarily leave a burning building. The game was up. The multi-billion-dollar house of cards, built on a foundation of questionable science and aggressive marketing, came tumbling down. The fallout was immediate and immense. Panic, confusion, anger. Millions of patients suddenly learned that the drug they relied on, the drug they trusted, was a potential killer. Doctors were inundated with calls. Should I stop taking Vioxx? Am I at risk? Section 6, Aftermath Accountability Optional. So, Vioxx was gone. But the story, it was far from over. What followed was a legal firestorm. Tens of thousands of lawsuits were filed against Merck. People wanted answers. They wanted compensation. They wanted justice. Merck, a corporate giant with deep pockets and an army of lawyers, initially vowed to fight every single case. They argued that they had acted responsibly and that Vioxx was safe when used as indicated for most people. It was a bold stance considering the mountain of evidence and the sheer number of alleged victims, but this is Big Pharma, folks. They don't go down easy. Eventually, even Merck realized that fighting every case individually would be a long, expensive, and reputation-shredding nightmare. So, in 2007, they agreed to a massive settlement. $4.85 billion. Yes, billion. To resolve most of the Vioxx-related personal injury claims. It sounds like a lot of money, and it is. But let's put it in perspective. Vioxx had generated over $11 billion in revenue for Merck during its 5 years on the market. So the settlement, while substantial, was less than half of what the drug had earned. For some, it felt like the cost of doing business, rather than a true punishment for corporate negligence. A very expensive parking ticket for mowing down a crowd. And what about individual accountability? Were any Merck executives held personally responsible for the decisions that led to so many deaths and injuries? Did anyone go to jail? Did anyone even lose their job in a particularly public and shameful way? You can probably guess the answer. Nope. Not really. There were government investigations, yes. Merck pleaded guilty to a misdemeanor charge for illegally marketing Vioxx for unapproved uses, specifically rheumatoid arthritis before it was formally approved for that indication, and paid a $950 million fine. But criminal charges against individuals for the heart risks? Those didn't stick.